So I've been using Biodentine in the BioBulk fill procedure for about 2.5 years. Previously, I was using a thin layer of Biodentine and then GIC on top, but I can see so many benefits for using it in the BioBulk fill procedure now. One being we apply it in thick section, and we know that Biodentine has similar physiomechanical properties to dentine, so I feel that that's really useful because it has the same compressive strength, flexural strength as normal dentine. When I'm using it in the BioBulk fill procedure, where the Biodentine is most important, for example, if a patient has a perforation and I put Biodentine on top of that, when it's applied in thick sectioned, I'm not worried then when I put my coronal restoration that I'm disrupting the properties of Biodentine where it really matters, where the perforation is or where the pulp is. I'm spending less time on their treatment. I also think that I can use Biodentine in a better way. I think it's made my workflow a lot easier. It has fewer clinical stages and therefore less clinical time. I don't have a problem with the washout of the material, and I do most of my dentistry in a single visit when I use Biodentine. So I quite like the BioBulk fill because I put a thick section of the material there, and therefore I'm not worried when I put my coronal composite restoration in the same visit that I'm going to damage or impact the material where it matters the most, for example over the pulp or near perforations. In terms of the clinical workflow, I always tell my patients before that it's going to be a 12-minute set for this material. So they're very prepared before, and my nurse is prepared, and my treatment time has that time allocated to that appointment. So I set a timer on my computer, and when that timer rings, me and the patient are ready for the next stage. So I will do things like my clinical notes, my nurse might tidy up a little bit around us, and I always sit the patient up so that they're a little bit more comfortable. They're prepared before that this is going to take 12 minutes to set, and therefore sometimes they'll bring some headphones with them or a podcast, and it's built into the appointment, and I think that's very important. I think the danger comes when you are rushing that stage and you haven't allocated the time for it, and then you're not prepared for it, and they're not prepared for the sitting around doing things. I bond the composite, yeah. And I do that by selectively etching the enamel and then using a self-etching bond for the dentine and the Biodentine component. And then I put my composite on. I also sometimes use alcohol just in the coronal part on a microbrush, not over the Biodentine, but just over the enamel and the dentine portion. And I find that allows me to do the BioBulk fill procedure in one visit because it's very nice and clean surface area for the composite to bond to. I think use it how you're comfortable. So if you want to do it in a single stage or over 2 stages, that's fine. I think one of the most valuable things I've learned is it's very easy to use Biodentine when you have 4 walls of a restoration. So for example, if you have a mesial or distal wall missing, I would build that wall first up in composite, and then you are left with a 4-wall defect just to build the Biodentine in, and then you can cover that with composite, so it becomes very easy to place the Biodentine. I think that's the biggest tip that I've found when using it. A satisfied patient for me is when they have the treatment done, they're not in pain. After the appointment, they're not in pain, and they get good long-term results. And for me, using Biodentine XP is the best material for that if I'm working in close proximity to the pulp. I find it predictable.